Benign tumours. What are benign tumours? Benign tumours are overgrown and proliferated cells. They are classified according to the cells and tissue they originate from. They can originate from the epithelial, glandular, endothelial, muscle, connective and neural tissue. Benign tumours are differentiated from malignant tumours by metastasis, localization, invasion, hemorrhage, growth rate, capsulation, age and gross appearance. An example is seen here, where metastasis and invasion is seen in the uterus. A metastasis and invasion is only seen in the malignant tumour, where it's localized in the endometrium of the uterus.
The causes of benign tumours. A benign tumour may develop if the immunosurveillance mechanism fails to function. Immunosurveillance is a mechanism that monitors abnormal proliferations of cells. Once they are detected by the host immune system, they are destroyed before a tumour can develop. If this mechanism fails, neoplastic cells can develop. There are risk factors that can increase the risk of developing benign tumours. This includes environmental causes, diet, local trauma, injury, infection, inflammation, and social factors. For example, smoking can cause Warthin's tumours, which affects the parotid glands which makes up most of the salivary glands. The tobacco smoke can irritate the ductal epithelium, which activates the tumorigenesis. However, most cases of benign tumours are associated with gene mutations. Some individuals may have changes in their genes during their lifetime or may inherit the mutated gene. For example, hemangiomas can be inherited due to an autosomal dominant trait. To date, the development of benign tumours is still unclear. However, there is some evidence that there is a genetic element involved in the process of benign tumours.
Hello, my name is Sarah and I'm talking about morphological changes in benign cells and malignant cells. In benign cells, they mirror normal cells. Hello, my name is Sarah and I'm talking about morphological changes in benign cells and malignant cells. Benign cells, they mirror normal cells when it comes to division and maturation, and their shape is usually round, oval or bean-shaped. The chromatin is evenly distributed in nucleus and cells, and mitosis rarely occurs. When it comes to malignant cells, the cell division and maturation is abnormal, which results in their size being varied. The chromatin is unevenly spread out through the cells, and that leads to hyperchromasia, which is an increase of their amount. Also, the mitosis process occurs quite regularly.
Most benign tumours are asymptomatic. However, factors such as tumour size, location, and complications arising from the tumour can cause changes in the body. Adrenal tumours are localized in the adrenal glands, just on top of the kidneys, and they can be categorized as functioning or non-functioning. When it's non-functioning, they are asymptomatic, and the only visible aspect of the tumour is a mass or growth in the adrenal glands. When they are functioning, they can produce or secrete adrenosterone and glucocorticoids. When the body has a high amount of adrenosterone, it can cause primary hyperaldosteronism, and which causes hypertension, hypokalemia, and hypernatremia. When the body has a high quantity of glucocorticoids, will cause symptoms from Cushing's syndrome. So when we have a non-dependent ACTH secreting adrenal adenoma, will cause Cushing's syndrome, and the high amount of glucocorticoids in the body will produce symptoms such as depression, altered cognitive function, thin fragile skin, and easy bruising. And you can see here in the picture as well some signs. So the moon face shape, the striae, and the poor wound healing. Meningioma is a tumor localized in the intracranial bit of the brain, and it's a very it's asymptomatic, but because due to its localization, it can cause symptoms very easily. So the symptoms include headache, seizures, vomiting, behavioral alteration, and papilledema. Nevus, it's a benign tumor, it's asymptomatic, but they are all visible in the skin. So we can have this type that is most common in old people. So the older you get, the higher the probability of getting these benign tumors. And then this one as well, and the junction nevus, which a lot of people have them. Connective tissue, it's more localized on the skin surface, but it can also be inside, like in the mouth or even genital areas. The fibroma is from the connective tissue. The lipoma is under the skin surface, and it has fatty tissue. And the hemangioma, it's most common in babies and has this clinical aspect.
An example of a tumour of epithelial origin is a fibroadenoma of the breast. It's a common neoplasm in young adults with sizes ranging from 0.5 centimetres to 15 centimetres, depending on whether you're a young adult, a child, or have a giant fibroadenoma. It can be diagnosed using mammography, however ultrasonography is preferred as images are more specific and the quality of images is ever improving. Also, histopathological examination is very beneficial too. So the image over here shows ductal structures that are embedded with the fibrostroma and are also lined. Okay, we'll cut that bit. And then, so the image over here is embedded with the fibrostroma and is lined with epithelium and fibroblastic stroma. And the image over here shows an oval shape. The image over here is an ultrasonographic image, which is another. Okay.
Start the whole slide.
Okay. Good. The image here shows the ductal structure, which is embedded with the fibrostroma and lined with epithelium and fibroblastic stroma. The ultrasonographic image over here shows an oval shape where the lesion is wider than it is tall. This is a characteristic of benign tumours, as it shows that the tumour is following the tissue planes rather than crossing it, which is what malignant tumours do. Also, aiding ultrasonographic diagnosis would be hyperechogenicity, because this is a characteristic of benign tumours. An example of a tumour of mesenchyme origin would be cardiac cavernous hemangioma. This tumour is a rare benign neoplasm that accounts for roughly 3% of the 75% of benign primary cardiac tumours. It usually presents itself in the ventricles, the valves, and the atria, and a range of imaging techniques can be used, such as CT, TTE, CMR, and MRI, and also histological examination is very beneficial. So, as you can see in the images, histopathological examination is very easy with this tumour. It shows large vascular channels that are lined with a flattened endothelial, which are. Okay.
Start the slide.
Okay, start. Sorry, guys. So with this image over here, histopathological examination is very simple with this tumour. In this image here, you can see the large vascular channel, which is lined with a flattened endothelial and fibrostoma. Sorry, guys. And a fibrostroma.
No. Okay, start again.
Sorry. Okay. Histopathological imaging. No shit. Histological examination of this lesion is very simple. As you can see here, it has a large vascular channel which is lined with flattened endothelium and fibrostroma, Over here, this shows a CT scan imaging of the lesion. So this is the tumour here, and on moderately enhanced CT you can see the heterogeneous lesion. Another benefit of CT scanning is that you can see the calcification of the tumour.
Hi, my name is Michael. I'm going to be talking to you about the treatments of benign tumours. To start with, normally benign tumours are not treated as they do not metastasize. However, with that being said, the doctors are taking an observant approach to it to see that it stays at the same size, or the features of it, the morphological features, do not change. If it does not stay the same size, like non-intracranial tumours, they do get excised by surgery. So surgery can be an option for tumours that grow and start to invade on important vital organs. As well as surgery, radiotherapy can be used to help the surgery. The application of radiotherapy is the focus of high radiation at the site of the tumour. So application before surgery is known as neoadjuvant radiotherapy, whereby it helps shrink the size of the tumour before it is excised. Also, it can be applied afterwards. Radiation can be applied externally, whereby a machine focuses the radiation, or internally, where it can be ingested using radioactive material or injected into the system. Radiosurgery is a combination of the two, and it was developed in 1950s by a guy called Lars Lexell. It's a process which consists of concentrating high X-ray and gamma rays at the site of the tumour, and it's good for intracranial tumours because it's very precise, and the intracranial tumours have well-defined borders.
Hi, I'm Paris, and today I'll be talking about current studies and future advancements. MRI scan development, termed diffuser tensor imaging, is an imaging procedure that differs from a conventional MRI in where it maps the diffusion of biological molecules, principally water, through tissues. These patterns can highlight gross details of the pathological state of the tissue under investigation. This technique has been successfully applied to viewing tumours of the brain, but further research advancements are being applied to this technique in order to expand this scan's use to not just brain tumours, but to diagnosing tumours throughout the body. Combining PET imaging with fluorine-18 fluorodeoxyglucose produce even better images than using a PET scan alone, as FDG is highly sensitive, as every cell in the body uses glucose. The benefits give this technique great potential for future studies into the development of its application for use throughout the entire body. Anti-inflammatory treatments such as NSAIDs and aspirins are the general drugs used to treat benign tumours, along with other inflammatory conditions. Nonetheless, radiotherapy should be at least considered for exceptions such as aggressive fibromatosis and follicular lymphoma. Radiotherapy uses high-energy particles to destroy cancerous cells. However, RT isn't generally applicable to benign conditions, as this can cause irreversible damage to cells, even at low doses. Although ISRT is now the preferred method, as it focuses the radioparticles on a smaller area to limit the damage to healthy cells. Cryothermal ablation is best applied when used in combination with CT, MRI or ultrasound scanning for effective planning and monitoring of the procedure. Cryoablation uses cold energy to form intracellular ice crystals within tumour tissues, which destroys the cells. This is done by repeated freezing and thawing. Subsequently, the destroyed cells are removed using suction and follow-up sessions to repeat the procedure. The diagram displayed shows the application of prostate cryoablation therapy. Advancements in this therapy include the development of the pull-out technique, which demonstrates favourable safety in carrying out the procedure and overall increase in patient tolerance and aftercare. Limitations thus far for cryotherapy are the fact that they cannot be widely used as appropriate treatment for benign or malignant tumours such as submucosal tumours and extrinsic tumours such as gastric tumours. Thank you for listening.